Hello, my name is Toyosi Ivan Osama Borg. The country I chose to do my research on in comparison to the United States of America is Canada. I have always heard that Canada has free healthcare, which is actually just publicly funded, so I wanted to learn about how Canada's healthcare system works and what lessons the United States can take from this system. How healthcare is financed and access is the biggest difference between the US and Canada. The US operates in a market-based system where individuals get health insurance from government programs like Medicare or Medicaid, or from employers and private plans. An individual's income and employment heavily influences if they can attain coverage and access to healthcare. On the other hand, Canada utilizes their own version of Medicare, which is a single payer system and is publicly funded through taxes. All Canadians do not pay out of pocket when they go to the doctor or hospital, as they all have access to basic medical care. Canada spends half as much per person on healthcare as the US because of this. Canada is still able to achieve longer life expectancy, better population health outcomes, and lower infant mortality rate in comparison to the US. Although there are longer wait times for specialist procedures and certain electives is a trade-off of this Canada's single payer system. McLuhan's funds, flows, and incentives theories best explains the difference between the two systems. Providers are often rewarded for the quantity of services rather than the quality in the US because the flow of money depends on private insurance reimbursements and profit incentives. However, it is important to note that even though the US has historically functioned on a fee-for-service model, efforts are being made to shift toward value-based care. Funds flow from the government to provinces and territories that directly pay hospitals and physicians in Canada. Equitable access and cost control, rather than profit, is the focus of this incentive structure. This explains how Canada is able to provide universal healthcare for its citizens, even though speed and consumer choice are the trade-offs of this system. True reform, depending on the alignment of payment systems with health outcomes, is an insight that stood out to me from McLaughlin's discussions of reform theories. From my research, I discovered that the US ranks last among high-income countries in overall access to cost efficiency in comparison to Canada, which ranks high on equity and affordability according to 2023 Commonwealth Funds reports. To summarize, Canada uses a single payer model called Medicare to provide access and affordability over profit to its citizens. The US struggles with cost and equity even though the country leads in innovation and specialized care. My question for my peers is, do you think the single payer system could be utilized in the US even with a bigger population, greater diversity, and unique political setup to Canada? Thank you.